Welcome to my podcast, Dr. Mina. It's a real pleasure having you here. Just wanted to hear a little bit about you and what drew you to the field of dermatology.
Oh gosh, thank you so much for having me. I'm thrilled to be here. Thank you so much for having me. I know talking about skin, it's something I love to talk about, and I know a lot of people listening have questions, concerns, and it's just really overwhelming to know how do we take care of our largest organ. So yeah, I get this question a lot, like how did I decide to go into dermatology? And I had an interesting intro into medicine, actually. A lot of people in my family are doctors, but that was never on my radar. I actually was a ballet dancer. I loved the visual arts. I even went to a boarding school for all that. And my plan was not to apply to college, to go straight to a ballet program and dance or company. And anyways, I did that for a couple of years. I tried that out, and then I got injured and realized I had my whole identity wrapped around being a ballet dancer, and then that was taken from me. And I had to figure out what else I liked and who else I was. So that was my first awakening at 21. If you're only known for this one thing and then that's taken away from you, like what's left and who are you? And you got to like reinvent yourself. And I thought I wanted to do something. I knew I wanted to do something in the sciences, and I wanted to help people. And I was seeing a physical therapist, and I initially thought, oh, I'll do PT. And actually the school I was going to said that I couldn't just go into their PT program right away. So it was by default that I ended up just doing some prereqs, the classic prereqs for medical school. And I really loved it so much. I especially love my anatomy and physiology class that I thought, you know what, maybe I could do medical school. I always thought, oh, it's too arduous. It's going to be too long a journey. I needed to have decided that at 6 years old. And once I really looked into it, I realized, wait a minute, this is possible. I can make this work. And I really put my head down and grinded it out, and thankfully ended up getting to go to medical school. And then I think because my interest in the arts, dermatology was like one of those fields that just kept popping to the top of the list for me. And I love that about dermatology. I get to work with my hands. I get to speak with my patients. I get to look at them and know what's going on with their overall health. I just think that's such a cool thing. So it's been a great field for me. I love it. And yeah, I love it so much. I even talk about it outside of work, right, with my podcast.
Yeah, you have a great podcast. I've been listening to it when I'm driving in my car, and I learn a lot of things from your guests and from the information sessions that you have with them. As we develop into our practice, we develop a niche as to what it is that we particularly like to treat or see when we are full-fledged physicians. What would that be for you?
Yeah, so my practice is my partner, my last name, and it's derm surgery. So we are like a boutique, and not something you see a lot nowadays, but our practice is procedural dermatology. So I don't do general dermatology. I don't manage inflammatory skin conditions. Every now and then an acne case or patient comes in, but predominantly what I do is anything procedural. So this basically means Mohs surgery, which is something that I'm fellowship trained and board certified in. And it's a technique to remove skin cancer. And unfortunately, the number of skin cancers just continues to explode and skyrocket as we're living longer and we're in the sun more. I do a lot of skin cancer surgery, a lot of basal cell squamous cell melanomas, even some more unusual or lesser known skin cancers. But then also we do a lot of cyst and lipomas. And I joke with patients that I'm Dr. Pimple Popper ATL. I'm like the East Coast version, but similar stuff that she does, rhinophyma surgery. Today I was doing sclerotherapy for veins, of course, Botox and fillers and biostimulants. Those are staples. So in procedural dermatology, that is what I mostly focus on.
Okay. And then I'm sure there are a lot of patients who seek you, obviously, for the skin cancers and the removal. In terms of guidance that you provide for them, as we get older, right, our skin changes. But with that, prevention is key. What we do in our 20s, right, affects us when we're in our 30s and 40s. How do you educate your patients in terms of taking care of their skin as they are maturing?
Yeah, so you're absolutely right. Prevention is so key. And unfortunately, our as I was working in our healthcare system that we have here, prevention is not something that's really advocated, at least covered by insurance. I know there are a lot of physicians who want to advocate for prevention and things like that, and it's really hard. But yeah, the best way to have beautiful skin in your 50s and 60s is to take care of it in your 20s. The problem is when you're in your 20s, you don't want to think about being in your 50s and 60s, right? And you're worried about other things and not so much a skin cancer. And what I found is for my younger patients, and this actually worked for me as well before I was even going to medical school, is that you tell people it's going to prematurely age you. And that seems to resonate more with the younger people. And just a quick story for me is that I was in my early 20s and I met someone I'd never met before. And she asked me how old I was. And I think I said 22, something like that. And she said, "Oh my gosh, I thought you were like 28, 29." And I was like horrified. I thought, how does she think I'm that old? And I was going to tanning beds and I was getting little lines around my eyes and I wasn't taking care of my skin. I was trying to tan. I didn't want to be pale. And it was already starting to show. And that really was a wake up call for me. Wait a minute. If people think I'm almost a decade older than I am, I don't want to start that now. So I find that does resonate, unfortunately or fortunately, with younger people. They're not really worried about skin cancer. But I don't want people listening to be like, shoot, I'm 45, I'm 55, it's too late. I see this a lot with my skin cancer patients who do tend to be older. And they'll say things like, what's the point? Is it too late? But it's never too late, right? You could live to be 100 plus nowadays. My grandmother is. So it really is never too late. The best time to plant a tree was 20 years ago. The next best time is today. So do what you can. Try to be safe in the sun. Try to take care of your body. I think that's another thing we don't realize. And again, I was guilty of this too. Like I didn't take care of my overall health. I was so busy trying to be a really good doctor and study hard. And I'm taking care of everyone else but myself. And that we underestimate the power of that and making our skin look great. So yeah, prevention, and I also think people have this because we'll watch TV shows where people get makeovers and you'll see celebrities that look like they never age, but you have to remember that's not really reality. The celebrities getting these things done, they have really unlimited deep pockets and they can afford to spend exorbitant amounts on things. But in general, we've got some really cool things out there and we do amazing things in cosmetics and aesthetics, but not everything is 100% fixable. And so the best step is just to try to prevent it or to slow things down as much as possible.
And you were mentioning the celebrities who have obviously a lot of resources, a lot of money for procedural stuff and products that may be not affordable. In terms of the layperson, what product, we're not, sponsoring anybody here, but like what products in general do you recommend for your patients?
So I'm pretty basic. So I'm not one of those people that really loves a complicated skincare routine. I don't like to spend 30 minutes getting ready in the morning or winding down in the evening. Like I'm all about efficiency for me personally. To me, I don't want to spend money I don't care what the product packaging looks like per se. I just want it to work and be effective. So most of my products or the things that I use are from the drugstore, but they're from really well-known skincare companies that have dermatologists helping develop and create. And they are doing research to show that it's beneficial. They're using ingredients that are safe and well studied. These are the companies like Neutrogena, CeraVe, Cetaphil, Vanicream, La Roche-Posay, right? Like Aveeno, Dove. These companies are wonderful. They're great. They make wonderful products. So you don't have to spend a ton of money on skincare for it to be effective. Although I will say I am sticker shocked on the prices of even those stuff nowadays. But you don't need to spend $200 on a cream you can only buy in your dermatologist. If you love it and you really think that is making the difference in your skin and it's not hurting your bottom line, then go for it. I'm not saying everything expensive is bad, but for me personally, I would rather invest my money into maybe doing some Botox and doing fillers or doing little procedural things rather than expecting this one $250 neck cream to do things that are really like unrealistic.
I think we operate in the same way, and this is what I usually recommend for my female patients. My patient demographic, as we were talking offline, are largely women in their late 30s to 50 kind of range. And a lot of them are looking not necessarily to reverse time, but look as presentable as possible. But they're dealing with things in terms of menopausal changes, right? Like the fine lines, the wrinkles, you have the age spots sometimes. What do you recommend for these kind of patients?
Yeah. So I'm right there in that window as well. So I get it. Right. I feel like you can fake it in your 20s, maybe even your early 30s. But once you hit your late 30s, your 40s, like stuff starts to show and whether you're taking care of your skin or not. And then, of course, yeah, like perimenopause can those symptoms and everything can appear years before you actually hit menopause. So it's a challenging time. I feel like it's a time we're finally discussing in the public and hopefully have some further research coming out. But for skin, this is the age, like really knuckle down if you haven't with like sun protection, getting on a good skincare regimen, make sure you're using a gentle cleanser. You're probably going to need a moisturizer. You may have had oily skin in the past, but you're likely noticing your skin's getting drier. So you definitely want to make sure you have a good moisturizer that's thick and creamy and helps keep your skin hydrated. This is also, I use a vitamin C serum in the morning and a retinol or retinoid in the evening. So I think that's helpful to be on as well if you're not. And that's my skincare routine right there. Just those, what is that, 3 or 4 ingredients or products, not a ton there. And then this is also the time that people can start developing skin cancers. Checking in with your dermatologist to have a skin check would probably be a good idea, especially if you've had some sunburns, which I think most people have. And then if you've got any skin issues, they can address that. So you may have some discoloration or some brown spots on your skin, or your complexion may be irregular. There are things we can do to even that out. And I think the person, like you were saying, who isn't trying to reverse the clock, but is just trying to look their best, those are the people who really get the best results if they want to dabble in cosmetics, because they've got a very realistic expectation. Like they're not trying to look 20. They just want to look their best at 39 or 45. And I find that this age is a good age if you're interested in getting to doing some cosmetics. It's a good age to get started because you usually don't need a ton of stuff. Just a few little things here and there can really help maintain. So I think of like pro-aging instead of saying anti-aging, and it has 3 prongs. You want to do prevention, then you want to maintain what you have, and then lastly, you have like regeneration. And so, yeah, I think at this age, focusing on maintenance, trying to collagen bank, because that collagen is going to plummet once we lose our estrogen and once menopause hits. You can even have a 30% decrease in your collagen within the first few years after menopause. So that's why women will say, I feel like I woke up and my face just fell. So trying to boost your collagen is another thing I really encourage my patients in this age range to think about.
That is actually a great topic. And it's a question that a lot of my patients ask me. And I think a lot of them are going to be listening to this very closely. People ask about collagen products. Should I be using them just topically, or can I take them internally? What do you recommend and why?
Yeah. So collagen supplement, let's see, collagen period, right? Everyone's all about that. I find the creams, the collagen molecules are just too big to penetrate through your skin surface. So if you're going to do collagen, I would not recommend, I think if it says it's in your moisturizer, it's really just being a moisturizer. There have been like a meta-analysis looking at collagen supplements, and they have found that actually there are some studies showing some improvement in skin hydration and elasticity, and then also improvement in wrinkles when taken every day for 90 days. So I think this is a pretty simple thing for people to try. In fact, I even started doing it a couple months ago. I just put a scoop in my coffee. So that's something people say it can be expensive. I find that Costco has some that seem fairly affordable. I think just keep in mind, just doing this one thing isn't going to make you look like you're 15. But that's just maybe one, I think, a pretty safe, easy thing to try. Sun protection, that's like the best collagen booster out there. So the sun breaks down that collagen more than you realize. So sun protection is, of course, a favorite. Retinoids, these are like the holy grail of boosting collagen in a topical formulation. So don't waste your money on a collagen cream. Invest in a retinoid, because that's really such a powerful collagen booster. So that's why I love that in the evenings. And then I love things like biostimulants that we know will build your collagen. So these are things like Sculptra and Radiesse. If you're looking for something natural, it's super, super natural, because these little particles basically are injected into your skin and they stimulate your own collagen. So it's different from fillers like Juvederm and Restylane, where we're actually injecting a material called hyaluronic acid. And I use hyaluronic acid products too, but I find when you do too much of them, you can get that really stiff look that we've all seen, or those unnatural chipmunk cheeks that just they look overdone. And what I like about versus Sculptra or Radiesse is that it's your own collagen. It's a very natural, more gradual way to build your collagen. So I'm a big fan of that, especially if you start it early enough, and it can really help you hold on to that. And then procedures can help, doing IPL procedures, doing some resurfacing procedures, causing little micro traumas in the skin, like microneedling. These are all things that can help boost your collagen as well. But really the biggest, if you're going through menopause, is estrogen, is repleting. We know why this is happening to women. It's because our estrogen has dropped and it's gone. And that is the reason. So if you really want to get to the root of it, then talk to your OBGYN or GYN about hormone replacement therapy if you're a candidate. And then this is an interesting thing I've discovered, is that even if you're on the patch, you can still or should still use the topical cream, estriol cream, because they work in different ways. And so a lot of women may have heard of using that sort of in the vaginal area to help plump the skin, help prevent infections, help with dryness. But now people are using it on the skin of their face, the top of their hands, their neck, because our skin also has estrogen receptors.
So where can my listeners find you in terms of your practice, your website, your podcast? Let us know.
Yeah, this has been a lot of fun. Thanks so much for having me. I practice in Atlanta, Georgia, mostly procedural dermatology, as I mentioned, at Baucom and Mina Derm Surgery. And if that's too far away, then you can just check out my podcast, which is The Skin Real. And I always laugh because in today's day and age, I have to spell out real, REAL, like real information. And my social media handle is at Dr. Mina Skin. And I do a lot of posting on all the platforms, educational, for fun as well. And yeah, I think we don't have to take skincare so seriously. We can have fun with it. And yeah, I just want people to know that having beautiful, healthy skin is within their reach, is not out of their budget, and they don't have to do these crazy, ridiculous things to get it.
I can definitely testify that Dr. Mina has a lot of useful information on her podcast and her website. So I would definitely encourage my listeners to go there. Thank you so much for, spending time talking with me today and being on our show.
And if people out there are wondering, how do I put together a skincare routine, what would I recommend? I do have a free email PDF that I can send to you. It's at theskinreal.com/habits. And I will send you how I counsel my patients and recommend creating a healthy and simple skincare routine.